Good afternoon, everyone, and welcome. We'll get started in just a minute, just giving folks a moment to get in, but we appreciate you joining us and looking forward to a great webinar. Got a bunch of people coming in, and we'll get started in just a minute. Waiting on a few more, and we'll get going.
All right.
Yeah, go ahead, Shar.
I'll kick us off. Welcome, everyone, to today's webinar. My name is Shar from the Lyft Healthcare team. We're excited to present today together with Thalamus on GME strategies for resident well-being, a webinar for thriving in training. I'll be your moderator today as we talk through many topics concerning GME community and get to know the thoughts of our industry colleagues and take some questions along the way too. While we're waiting for all our colleagues to log in to the webinar, we'd love to do a starter poll so we can get to know who's in the room with us today. So we can launch that poll. We'd love to know who's here. Get to know your industry colleagues. Are you DIOs, GME managers or directors, programs and admin coordinators, residents in a GME program or other GME faculty? We'll give you guys a few seconds to enter your poll. All right. Let's see who's in the room with us today. Awesome. Lots of GME managers, program admins and coordinators, and a few other different faculty. Great. All right, let's get started. I'm excited to present our speakers for this webinar today from both the Thalamus and Lyft Healthcare teams. I'll start off with Jason Reminick, MD, MBA, MS. He's the CEO and founder of Thalamus. Dr. Reminick trained in the combined pediatrics and anesthesiology residency program at Stanford University Medical Center and the Stanford Children's Health, Lucile Packard Children's Hospital. He graduated Alpha Omega Alpha from the University of Rochester Medicine, while concurrently earning his MBA from the Simon Graduate School of Business, concentrating in entrepreneurship and health science management. He graduated cum laude from the University of Pennsylvania, majoring in biochemistry and theater arts, while concurrently submatriculating to earn an MS in chemistry. He was recognized as a Physician of Tomorrow Award recipient in 2012 by the American Medical Association for his entrepreneurial, humanistic, and medical journalism pursuits. He was a member of the Stanford University Society of Physician Scholars, Joseph Collins Foundation Fellow, and an AMSA Medical Humanities Scholar. Dr. Reminick's research is featured in leading medical journals, including the Journal of Graduate Medical Education, the Journal of American Medical Association, the Journal of American Academy of Orthopedic Surgeons, and Anesthesia and Analgesia. He is nationally renowned expert on the undergraduate medical education to graduate medical education transition, including many key topics regarding residency and fellowship recruitment into the match. Lyft Healthcare is thrilled to be partnering with Dr. Reminick and the Thalamus team today. Next, I'd like to introduce Betty Yen from the Lyft Healthcare team. Betty is the head of healthcare and university partnerships at Lyft, where she's been instrumental in building the healthcare division and shaping the evolution of Lyft Healthcare's products since joining the company in 2018. Initially recruited to lead Lyft's payer partnerships and patient transportation, her role has expanded to include a broad and diverse portfolio encompassing payers, providers, including over 500 hospitals, emerging healthcare organizations, and academic institutions. Betty is driven by a deep passion for improving access to care and health outcomes to underserved populations, and she brings a strong background in healthcare strategy and operations. Prior to Lyft, she served as a managing director at Evolent Health, partnering with health systems to implement population health initiatives and value-based care models. Her early career includes key roles at Eli Lilly, Medi Analytics, and Triage Consulting Groups, where she began her professional journey working with hospitals on revenue cycle engagements. Betty holds a degree from the University of California's Marshall School of Business and lives outside of New York with her husband and their two young children. So welcome to both our speakers, and thank you for sharing your thoughts here with us today. I'm going to hand off here to Betty to get started.
Great. Thanks, Shar, and thanks everyone for joining us. So a bit about Lyft Healthcare, and I think first I need to start with our mission, which our mission is to serve and connect. And I think that's the mission of most of the organizations on this webinar today. And we really think about this as our mission to serve two different groups, to serve riders, but also serve drivers, and to connect them through our double-sided marketplace. And we think about the opportunity that we have to improve truly the world, to be able to not only provide safe, convenient, and affordable options for transportation, but also thinking about how we can do more every day, whether it's through reducing carbon emissions, providing opportunities where, for example, women drivers may not feel safe driving on our platform. And so we launched an initiative called Women Plus Connect. Those are all different initiatives that we lean into as we think about how can we provide more for our communities. Specific to my role in Lyft Healthcare, and I want to share this because still today, when I talk to my friends and I tell them I work for Lyft Healthcare, they think I buy health insurance benefits for Lyft employees. So there's a part of Lyft Healthcare that does not buy insurance benefits for employees, but is really around serving this ecosystem of healthcare. So organizations have come to Lyft and chosen to partner with us to stand up solutions for whether it's patients or staff. In the example of GME, which we'll focus on today, programs are really leaning on us to provide their residents, their fellows, with on-demand transportation options so that their fellows and their residents have an easy, frictionless way of getting transportation, and they can focus on other aspects of their medical excellence, not on these other more of the administrative or the logistical aspects. What we hear from our partners is that ultimately the goal of this is to help really attract, retain, and provide a better overall well-being for the residents and fellows going through this very stressful and demanding time in their career. And I'll pass over to Jason.
Thank you, Betty and Shar, and good afternoon, everyone. I'm Jason Reminick, CEO and founder of Thalamus. It's nice to see many of you. I recognize a lot of friendly names in the participants list, and really excited to be talking about a newer topic for us as part of this webinar. But for those of you that aren't as familiar with Thalamus or are familiar with Thalamus, we are the leading interview management platform for graduate medical education. We're working with over 8,000 programs, both residency and fellowship, at over 800 institutions nationally. We were the first medical education technology company to become a public benefit corporation. And so mission has been very, very important to us. Mission is what helped us align with the AAMC as part of the collaboration, which helped accelerate that growth for our organization. And I think mission alignment is one of the keys to today's webinar as well between these two organizations. And so our mission at Thalamus is to ensure that the right doctor ends up at the right hospital to treat the right patients. Right can mean a lot of different things. How I like to describe it is it's 3 o'clock in the morning and a patient is rolling up to an emergency room, whatever hospital, having one of the worst healthcare events of their life. What can our team do upstream to ensure that that right doctor is there for them? And that can mean a doctor that speaks the same language, looks like them, reminds them of a close friend or family member, and ultimately results in better care. Our team is deeply passionate and committed to this community. almost half of our team comes from GME as either a director, coordinator, applicant, or somewhere in the GME office or anywhere in between. And we're really passionate about building solutions for this community that extends beyond the software that many of you are using. And so this photo is a most recent photo of our team from our all hands event in San Diego a few weeks back, where we get the team together once a year. And so we were doing a lot of thinking on mission and design thinking and how we can bring even more solutions to the community. And I think today's webinar is one example of that. And so really excited to continue on in this discussion. Next slide, please. So why we're here is to talk about resident wellness and really make the connection of resident wellness, and assuming we can promote what resident wellness will ultimately result in stronger GME programs, which thereby will create enhanced clinical learning environments and ultimately lead to better patient outcomes, tying back to the missions of both organizations here today. And so starting with a personal story that many of you heard, but providing it in a slightly different context. The reason Thalamus exists is when I was applying to residency, I got stuck in New York City during Hurricane Sandy and many of my interviews were canceled. And that was really the major catalyst for it. My co-founder, Susie, who's an anesthesiology residency program director, was recruiting residents in the middle of winter to upstate New York in the middle of lake effect snow winters. And so behind all of that are the people that are going through this process. And thinking back to those stories, and one which has really resonated with me, which as we were working to plan this webinar really jumped out, was a week after Hurricane Sandy, where I made my way out to interview with a program on Long Island. An applicant who was interviewing with me that day had paid $600 via cab. This was before the days of Lyft as well. And they went from Staten Island to Long Island. And the reason they needed that cab was because their car had floated away in the storm and their house was destroyed in the storm. And they were unable to reschedule their interview, which is something that still resonated with me now 12 years later, but I think is a really just important symbol and metaphor to graduate medical education, the transition to residency, and ultimately the challenges that people face going through this process, which is the major driving force behind a lot of what we're doing today. And so what we're hoping to do today is connect that mission for Thalamus, the right doctor really needs the right hospital to treat the right patients, to eventually get to better healthcare outcomes and thereby avoiding burnout. I've seen too many of my friends and colleagues go through this process, and the optimism that exists when you're a first-year medical student and then kind of fades throughout medical school and rejuvenates a bit in the match, but then kind of continues that degradation through the transition to residency into intern year, residency year, and beyond. And so how do we continue to promote that and accelerate that? And I think a lot of what Lyft Healthcare is doing here to address these similar pain points with resident wellness is going to lead to just overall a stronger and a happier and a more resilient resident workforce as well. And so that's what we're here to talk today. And I'll pass it over to Shar for our next survey question, but excited for the discussion.
Great. So as we dive into our agenda for the day, we'd love to know from all of you what your top priorities for your program or institution are for this academic year starting July 2025. Is it mental wellness and your residents' well-being? Is it taking part in making sure you're prioritizing recruiting for the right residents this year, improving the physical safety for your residents, or modernizing your current GME program or an institution? We'll give you guys a couple seconds here to answer the poll. I'm excited to see all of your answers and priorities for your programs. All right, let's see our answers. Okay, great. All across the board here. So all great answers. We can sense some themes amongst these topics too, and that's perfect because it takes us to what our agenda topics are for today. So we're covering just these things, starting with fatigue mitigation within GME programs, prioritizing physical safety for residents, resident wellness and mental health. We're going to cover some good stuff there, going into how recruiting and retention plays a crucial role in your GME programs, and tools like technology that might help out the game a little bit more.
Yeah, so we're going to talk overall about resident fatigue mitigation to start. And so next slide, please. And so this is a picture of me from my anesthesiology residency, one of the remaining pictures. Overall, key statistic here is that interns working a 24-hour plus period made 36% more serious clinical errors compared to those working 16-hour periods. And I know that work hours have been a long debate in graduate medical education and in the community and across med ed and otherwise. And there are good arguments on both sides. But in terms of the sciences, I think a lot of us would agree that humans weren't really made to be up for 24 hours working in 24-hour periods. Pilots are unable to do this, and they're often compared to healthcare in a lot of ways. And so just from my own personal stories, like anesthesiology requires a lot of focus. When anesthesia is easy, it's pretty easy, but when it gets hard, it gets hard, and it gets hard fast. And those two things can happen and change in an instant. And so I just recall overnight calls and being in the OR with cases that were some were incredibly challenging and some less challenging, but just even very simple cases when you're fighting that fatigue and trying to keep your eyes open in addition to watching the anesthesia machine and checking the patient's blood pressure and watching the heart rate and the pulse ox and everything you're doing in clinical anesthesia, and having worked also on the wards and in the hospital on the pediatric side and the adult side and in the ER as well, and all these different clinical environments. When you're tired, it really creates lots of challenges. And the other story that I remember is just even in working through this fatigue and preparing yourself for overnight call and looking to our residency program for resources, I remember the talk that we had that went through very similar sets of data and went through all of these different elements overall. And so when you look at all the resources that are available, they only are kind of band-aids on a much broader process. And so how do we put all of these pieces together to make this less fatiguing for residents as kind of an entryway to burnout? I remember the kind of the mitigation steps we had was sleep obviously in a call room when you could, if you had to be up for an extended period of time. Like I remember one of the steps was to have an ice cream, because that would kind of wake you up. And if you can get kind of that second wind after that 24 hours, you were kind of golden, because you kind of catch the second wind right leading up to the 28th hour. But then the 28th hour ends and you also have to get home. And so one of the other just pieces of Thalamus history is I actually used to take lifts on some days to the hospital, because I was either taking a nap and or working on some of Thalamus at that point as well, in that ride home down 280 from Palo Alto to Santa Clara in California, so I didn't have to drive myself. And so I've touched all different elements of this and experienced this firsthand. I know a lot of the folks on this call are obviously dealing with this day in and day out with their residents, and obviously this being a very, very key piece for us to being able to provide patient care and also just resilient and enhanced clinical and educational experiences aligned with the educational missions of your programs. And so excited to dive deeper into this overall, but I'll pass it over to Betty for our next topic.
Yeah, thanks, Jason. And just to take it one step further, I think we want to share what we've learned about the link between fatigue and exhaustion and what that means for physical safety. So on this next slide, we have a couple of statistics that they're staggering, they're sobering, but the reality is they're true. So these are from widely known studies that staying awake for 24 hours can impair cognitive function at a level similar to if you had a blood alcohol concentration of 0.10. The legal limit for blood alcohol concentration is 0.08. So Jason made the point earlier, we have protocol in place that prohibits pilots, even truck drivers, from working 24-hour periods, yet it's become the standard in the medical community to have 24, 28-hour call periods. And then the second point is This is not based on a recent study, but I think you would say the same based on what you've heard in your GME programs, that nearly everyone, so 97% of surgical residents reported that fatigue compromised their safety while they were behind the wheel in a vehicle going to or from work. And over 80% reported falling nearly or completely asleep. Um, this reminds me of a story that I heard while I was at a medical conference, and someone from the medical community came up to my colleagues and I, and they were just elated to hear what Lyft was doing in this space. The reason being they gave a very poignant account of what happened to them. So they had just gotten off of or just completed a 28-hour period. And look, they were fatigued. They were beyond exhausted, but it also just become normalized. That's just how they always operationalize. So even though they were tired, it didn't feel that odd. But they were more tired than usual. And they even contemplated utilizing some of the offerings that were encouraged. So they didn't eat ice cream like Jason, but they did consider seeking out a call bed or a sleep pod, or even finding their supervisor and letting them know that they were fatigued. And I think they had a policy in place that said you can even get approval to expense taxis or lifts. But what this individual shared was that the culture, at least what they felt, was that there was too much friction for them to go and um, ask for permission to take a lift or a taxi and expense that. And they felt like, one, they wouldn't even know where to find that person because they were on a busy floor. But also, there was a culture of maybe that might show weakness. And they felt like throughout their entire training in their medical career, it was all about, you've been so successful, you're at the height of your career, you've been able to accomplish so much, you've gotten into this incredible competitive residency program. And so they chose, like they often did, to get behind the wheel. They rolled down their windows, blasted their radio, all of the typical approaches to keep them awake. And then the next thing they knew, they were behind the wheel with an inflated airbag, just scars all up and down their forearms because they had fallen asleep at the wheel. And that's what we hear, I think, way too often. You all would know best around the reality of what's happening historically in the medical community between the intense hours, the burnout, and the fatigue that can translate to these physical risks. Shar, I'll turn it back to you.
Thanks, Betty. Okay, as we move on to our next topic on resident wellness, continuing to talk about resident wellness, we want to know from all of you, where does resident mental wellness fall in your upcoming GME institutional program priorities this year? Do you have a strong program in place for resident well-being already? Do you have a program in place, but it could use some improvement? You're looking for ideas for improvement. Is it a top priority of yours to develop a program like this year? Or, are you still working on developing really the foundational infrastructure to be able to have a program like this at your institution? I'll give you a few seconds to answer. I'm really curious to hear everyone's thoughts here. All right, let's see our answers. Okay, great. Looks like there's a strong 27% here that does have a good program in place that they're happy with. And then of course there's programs that, there's always room to make it better. And, other places, yeah, it looks like it's a priority to develop it, or we need further infrastructure support to make it happen. This is great.
Awesome. Well, I don't want this webinar to all be about the doom and gloom and the dangers of fatigue. So I think we're here to highlight what everyone on this webinar knows, and why everyone showed up here is that focusing on resident well-being is critical, and this is an increasing focus and area of attention for the medical community. On this slide, you'll see some stats. These are from a 2002 study that was done at the University of Pennsylvania School of Medicine, and what it looked at was, for this cohort, if you looked at these were first-year residents, so interns, if you looked at how they would answer these survey questions on day 1 versus day 365, what was the difference? And high sleep deprivation rose, moderate depression rose, burnout rose. I mean, we know this today is that residency is very demanding. It's not just demanding from the hours, it's also demanding from the work, the emotional weight of being with patients day in, day out, and sometimes delivering very difficult news, or sometimes going through very heart-wrenching experiences where you try your best, but maybe there wasn't anything that could have been done to save that patient. I think what I'll highlight here is that based on all of these studies and the data that's come out around the importance of focusing on well-being when it comes to graduate medical education, there's so many different programs and initiatives that we've seen different institutions put in place. So I think just generally there's an openness to focusing on talking about things like burnout, talking about ways to be able to think about balance, mental wellness. It's acceptable to have resources for therapy. So the medical community, thanks to the folks on the webinar today, the medical community is really paying attention to what are some of the ways that we can combat these statistics such as sleep deprivation, depression, but then also burnout. How do we encourage more people to go through medical school and become providers and become clinicians so that we don't have a shortage of clinicians in the US?
All right, and that brings us ties it into recruiting and retention, which is obviously kind of Thalamus's domain. And so to continue on that, and I was really excited by those stats of the last survey question, because when I started residency in 2013, I know these programs are becoming more popular and more prevalent, and it looks like that has continued to grow overall. And so that's a trend that I'm excited to see. It seems like there's a lot of overall good motion. And so we've seen this obviously at many of the academic and specialty specific conferences nationally as well, and growing over the years, and that the academic medical community is prioritizing wellness, and that many residency programs and institutions and fellowships obviously as well are building initiatives to support that broad commitment. And so next slide, please. And so as we've entered into a world of virtual interviewing and just other trends that we've seen in this transition to residency, I've been asked by more and more programs, like, how do we build a program that attracts and retains top talent? And I've talked to community-based programs that are brand new, and they've kind of started with the top of, we're going to define an educational mission. We're going to display that mission on our website, and that's where our competencies and what we're looking for in our recruitment are going to stem from. And we're going to use holistic review to identify those competencies, to find those applicants and those eventual residents that are going to align with our academic mission, our patient populations, or otherwise. And so that's one theme I've really started to see pop up over the years. The other one, more recent, because of the challenges with the impending physician shortage and just challenges in hiring certain types of physicians in certain regions of the country, or in particular specialties, many of which affect the revenue generating arms of the hospitals and the main revenue generating services that help fund other services in the hospitals. These have become pretty existential problems that one of the things we are seeing across all different types of academic and clinical settings, and nonprofit health systems and for-profit health systems and large academic systems and community-based programs, is many are starting to look at their resident pool much more closely as their future physician workforce. And so attracting the right or a resident that is well aligned with your health system at the residency stage gives you the highest level of and the highest likelihood of retaining that physician when they finish training. And of course, they have spent several years, 3 to 7, depending on the specialty, training within the ways of the health system. And we see this from a lot of the institutions we work with at Thalamus. And we've studied a lot of this, and knowing that geography is the main driver where people match, particularly same state geography. So if you're born in the state or if you go to medical school in the state, you have the highest likelihood of matching within that state. So you start seeing all these main trends that start happening. This is a study that we did out in California, looking at the California physician workforce and the disparities in the representativeness of the workforce versus the population. But one of the other things we found in this study was that California, where it has the second most medical school spots only to New York and the first most residency spots of any state in the country, when you adjust to its 39 million population, it drops to its 46th and 26th respectively. And so California is actually grossly underserved for its population and is a mass exporter of people at the medical school stage, and then they return again for residency. And so we've looked preliminarily at other states like Florida, New York, and Michigan, and Pennsylvania, and Texas, and kind of the very large states with large GME programs. And it's probably a very similar story. But overall, the net of everything here, particularly in a virtual world, is, okay, if all of those trends are true, and we're in a virtual world where in some instances the applicant has never stepped foot in our city or in our state or otherwise, how can we design programs in addition to our educational mission and redoing our website and all these other things that we can do to help better market our programs and get the word out and go to the residency fairs at our specialty conferences and use Thalamus to help uncover certain traits and characteristics of applicants that we know are aligned with what we're trying to do with our program. You start looking at other possibilities overall to attract those residents, which then can become your future workforce. And so at the program that I trained at, the cost of living was very high. So we, midway through my training, the hospital provided us with a housing stipend. And that was a big attraction for recruitment that we could talk about. And similarly with rideshare and many of the other benefits that the hospital systems provide. And so all of this, particularly in terms of resident wellness, particularly with the generations that are now coming through medical school and into residency training, looking for that work-life balance, using all of that data to figure out how you can build an attractive program for recruitment, how to get your directors, coordinators, faculty, everyone in the program, current residents and fellows aligned, how to look at rural programs, and how can we attract applicants to our rural programs, which are predominantly in more underserved communities. And so there are all these different programs you can build, also knowing that those folks from rural and underserved communities have the highest likelihood of matching there as well. And so taking all of this net, it's how do you use this to really define a package or a way to attract that talent, which isn't only going to help you attract them into residency, but eventually serve as your physician workforce post-training as well. And so a lot of discussions about this right now, and kind of excited to see this as this goes on going forward. And so next slide.
Awesome. All right. Well, we're going to transition now into tools and technology. And I mean, we're here, Shar, on the next slide. We're here because a lot of different health systems and hospitals have reached out to Lyft because they on their own wanted to know how we could partner with them to establish these transportation solutions for their residents and their fellows for this exact reason. Like Jason said, if you've gone through all the work of attracting the right fellows and residents for your program, now you want to be able to retain them. This is your physician workforce that you want to make sure that they are having a great experience and staying loyal to your institution. So on the Lyft Healthcare side, I'm going to share a story of this is a very large health system in the New York City area in a market that is hugely competitive for talent. And they came to us and expressed a challenge where they want to set up a transportation program for their residents. I think much like Jason said, they were asking themselves in discussions and planning discussions, we have budget allocated for meals. We have budget allocated for housing. Should we have budget allocated for transportation? And they start thinking about the critical role that transportation can play, particularly in those instances when residents are fatigued and need a safe way to get home. So they reached out to us, set up a program in a way that creates the most frictionless experience for their administrators and their staff, as well as for the residents themselves. That was their goal, was let's put something in place that is easy for everyone to use, easy for everyone to manage, but still gives us the controls. On this next slide, I believe we have a screenshot of what is this. So to back up, what you're staring at right now, this is Lyft Pass. So Lyft Pass is the offering that this health system in the New York City area used to give its residents. So they set up all of the parameters. So let's say that I want to set it up so that every semester, each resident gets 4 trips that they can take a Lyft. So 4 trips, 2 one-way trips, great. That's 8 unique trips per semester. They can put in that restriction. They can also establish parameters around the location and ride type. So perhaps they want to say rides can only begin or end at the actual location that resident is practicing. So they can define what does that location look like, how tight is that parameter, and then set the ride type. Maybe they don't want the residents taking a Lyft Lux, a Lyft Black, some of those higher end vehicles. They just want to have the most economic option. They can also customize things such as what is the budget per ride, or do I want to give them a discount off of each ride? What is the amount that I will cover per ride? This really allows them to control their budgets and forecast what this program and the cost might look like for their program. And then last, there's an opportunity to really provide what we call a surprise and delight experience, where they send the Lyft Pass to the resident, and the way that the resident receives it is either through email or through phone. And it's an opportunity for them to brand it with their logo, with their name, and say, ABC Hospital has sent you a Lyft Pass for fatigue mitigation. Here are the parameters. And then everything is there within their Lyft app. There's nothing more that they have to do. The Lyft Pass is in their account. It is automatically applied if these parameters are met. And then for the organization themselves, because they really want to be able to monitor and make sure that if we launch this program, who is taking it? Are they taking it for the right reasons? And they just want to get insight. What time of day, like what periods and which hours are residents typically using this benefit? What days of the week? And so the data allows them to get a lot of insights I don't think they otherwise would know through like the differences between residency programs, as well as just understanding how often and why the residents are utilizing this. So again, just to summarize, Lyft Pass is one of the tools, one of the technologies that we've seen particularly progressive health systems use to attract talent and to show that their program is unique in providing a really frictionless experience for their residents to get home safely.
Yeah, and similarly on the Thalamus side, as I've said, kind of the story of Thalamus is that I started out seeing the frustration and the burnout that was occurring in the transition to residency, starting with Hurricane Sandy and now continuing over the last 11 years. And Thalamus started as a place for applicants to schedule interviews. The eventual dream was that it be a centralized location where most of the interviews could be scheduled. And for me, a lot of that dream came to fruition when the collaboration with the AAMC came about, and we're allowing applicants to schedule in one place rather than having to, going back to my earliest recruitment days, trying to type on essentially a flip phone, a professional email, trying to pick interview dates for residency, which didn't work out too great in the middle of the storm. And we've seen similar hurricanes since in the middle of recruitment season. But on the whole, how do we build technology to make this process easier less frustrating, less anxiety inducing, less costly overall. And then we saw, major changes to this process through COVID and everything going virtual. And what came out of it was the extension of our platform into other areas in order to, for Thalamus Video, provide a way for GME to interview in a way that GME interviews, rather than having program administrators and coordinators to play air traffic controller to move people into and out of breakout rooms. How do we develop a screen for them to see everything happening on the interview day and develop a way so that everyone can manage and enter their own interview rooms that are reserved specifically for them to better mimic what would happen when everything was done in person. And obviously, other technologies came from that in terms of Cerebellum with dashboarding and outcomes. And the one we're highlighting here today is Cortex, because Cortex, through the collaboration with the AAMC, is now going to be offered complimentary to all ARIS participating residency and fellowship programs starting in July of 2025. We've expanded our brand and enhanced and matured our brand a bit with our new logo and our new look and feel. And so all of our products are getting a UI and user interface, user experience refresh. That's kind of one of the big projects for us now, given the amount of the community that's going to be using Cortex, which was designed to assist through technology, program directors in aggregating key application data, rather than having to go through scavenger hunts of the application, needing a Rosetta Stone to interpret various components of the application, like core clerkship scores, having to print out the application and go through it by hand and do word searches to try and find how many times your state was listed in the application as a marker for the applicant's likelihood of going there. And all of these different things allowed us to create Cortex, which has saved program directors 50% of their overall review time and facilitated a more holistic review of the applicants that they really want to review in that way. And so all of these things are coming together to try and achieve that mission. And this kind of sentiment, this kind of designing for the person behind the software, the one using it, the problems that they're needing solved, the ones that are going to make this process better for them, be it the program director, program coordinator, applicant, GME director, DIO, interviewing resident, fellow, whoever is in this process. How do we design a better process using technology? And this is why we're really excited to also be offering a sandbox environment, which will be out this summer as well, prior to the start of the fellowship season, so that any program that wants to move on to this and change manage onto Cortex for this season or not, but you'll have opportunity to use fake applicant data combined with your real program's metadata, your filters, your screen fields, everything you do in your process to design a process to attract those residents that you'd like and give you those tools to find that resilience, to find those residents who are not only going to help with your academic mission, but also promote broader wellness across your program as well and being part of that resident team. And so the whole goal behind this technology and what we approached this with was, how do we streamline identification of those applicants in strong alignment with the program, and also to help programs eventually not have to look at applicants that have a very low likelihood of matching in their program. And similarly, then on the flip side, how do we help applicants figure out where they're more likely aligned overall in terms of where they're going to eventually match, and really ensure that that fit between program and applicant and that alignment of the educational mission matches on both sides. That in itself, we believe, will promote even better clinical learning environments, decrease burnout, and allow residents and programs to thrive. And so we're excited to continue to build more technology alongside the community to really, really take even bigger steps in improving this transition to residency and beyond. So next slide.
All right. Just before we dive into this, we'd like to invite you all to put any questions you might have in the chat for our panelists to answer for you. Some key takeaways. So to summarize what we've discussed and we've learned here today, these are the key takeaways that we really feel will catapult your programs forward and help move the GME industry forward as a whole too. So collaboration, coming together to find solutions for some of these GME challenges that ultimately will help drive better patient outcomes is really, really important. drawing the line between resident well-being and those healthcare outcomes, whether it's mental or physical, both lead to better healthcare outcomes, the entire objective of our programs today. Technology, Thalamus, Lyft Healthcare, and many others can really help aid in some of this fatigue and wellness management for your residents. And then, drawing that connection between strong GME programs, recruiting and retention, retaining strong talent really pays forward in how your programs develop. Okay. With that, we'd love to take your questions from the audience and hear, what you guys are curious about and thoughts on our presentation today. I'll start with a question for Betty. How can we get Lyft Pass in our area?
Yeah, really good question. So Lyft Pass is available anywhere that Lyft is available. So Lyft covers, I believe the latest statistic is 94% of individuals in the US are in an area that Lyft serves. So long as Lyft is in the area that you're in, Lyft Pass is available. As far as learning more about how to specifically work with Lyft to set up the Lyft Pass program and learning more about this offering, the link that is on your screen in the bottom box, the go.lyftbusiness.com/GME Healthcare, that's where you can go submit your information, and someone from my team will reach out to you and make sure that you get all of the details that you need.
Awesome. This question is for Jason. What does a high-performing GME program look like?
I think it's a great question and something we often talk about, and we obviously approach it very much from the recruitment side in terms of how do we build the best recruitment process into our program to ensure kind of optimal outcomes in the match or otherwise. And I think the two are very closely related with regards to really defining that educational mission from your program. And similarly to, as we've seen Thalamus grow and scale and building culture within our own organization, how do you build that culture and define that culture within your program, knowing that there's a lot of great clinical learning environments, but how do you differentiate your program overall, and be that in recruitment or in your wellness program for your residency programs, or the support you offer your residents, or the network opportunities that exist in going to your program for residents to eventually allow them, when they finish training, to become those clinicians that they'd like to be. It really starts with intentionally defining and kind of building those programs and those philosophies for which then your strategy can be derived and then drop down into the tactical things that you can do to promote those elements within your program. And so I think a lot of us know what good looks like in programs. I think a lot of us also know what are strains on programs. I think there's also a lot of strain that's unavoidable just in residency overall as well. But working within the constraints of graduate medical education and residency, there are ways and there are systems that are doing this kind of more optimally than others. But there's also very varying resource constraints across the many clinical environments as well. And so I think it's very much a personal choice for the leadership of a program to get together and understand what do we want to make with our program? What kind of doctor are we trying to train? What kind of leader in medicine are we trying to train? What kind of extension of our current physician workforce are we looking to bring up through our residency programs? There's no one size fits all to this, but I think being intentional about it and designing it is overall key.
Thank you. Another question from our audience. This one's for Betty. How can we set up Lyft Pass? What is the best way to set up Lyft Pass for 500 residents? They also term and onboard about 200 residents on academic turnover.
Awesome. Great question. And I think the beautiful thing about Lyft is, at our core, we are a technology company. And when we think about how our product is set up, we try and make it as seamless as the Lyft app for people to use, even with Lyft Pass. So the way that would work with Lyft Pass and how we've seen other organizations set it up when they have, say, 500 residents, is that they set up a Lyft Pass program per residency program. And that's really if the programs have different parameters. If all of your programs have the same parameters, you could theoretically just set up one Lyft Pass program. But let's say maybe the pediatrics program has a different thought process or budget around how many Lyft Pass rides they're going to allow for their residents versus the surgery residency. And so each of those departments can set up their own unique Lyft Pass program, set those parameters. So the what we call geofence, where those rides are allowed to start and end from, the budget, the number of rides, and then once you set up the programs, you invite the riders within each program. You can invite them via email. You can invite them via their phone number. And then once they're invited in the portal in real time, you can see if that rider has accepted their Lyft Pass or has it not been claimed yet. And then if you have residents who term and you need to remove them from the program, you're able to do what we call revoke a Lyft Pass, so that even though it was in their Lyft account, you're able to pull it back out so that those funds, they disappear from their Lyft account, and you're no longer liable for them.
Thanks, Betty. This kind of maybe is a good piggyback off of that one. How do other institutions stop residents from taking advantage of the Lyft system? We currently require them to submit information to us as to why they needed the ride. This way we can help any ongoing issues so it doesn't keep happening.
Yeah. I mean, I think this is hard because it comes down to trust in the relationship between the institution and the resident. What we've seen pragmatically is that organizations have set up Lyft Pass programs that have a certain number of allowed trips. So when we hear about abuse, typically we hear about abuse in the sense that someone takes a Lyft ride all the time. It's so convenient that all of a sudden they're always fatigued, and that becomes unsustainable from a budget and a program standpoint. So we have seen programs that think through realistically how often do they expect for a resident to be so fatigued that they truly they should not get behind the wheel of their vehicle, and allowing an option like Lyft makes a lot of sense. And then they do that math, and that's how they decide how to set up their program. So it's totally up to each organization that's setting up the Lyft Pass program, what is covered under the Lyft Pass. The Lyft Pass could be as small as one ride ever, like a one-time Lyft Pass for one ride. But what we typically see is a Lyft Pass is given for a semester for a certain number of round trip rides, assuming that that resident leaves their vehicle at the hospital, then they're going to need a ride home. And then the next time they go back to the hospital, a ride back to claim their vehicle.
Thanks, Betty. And then one last one here on pertaining to that. Does the Lyft platform provide any reporting or analytics that could be used to demonstrate compliance with GME's fatigue mitigation and duty hours requirement?
Yeah, really good question. So the Lyft platform has access to all of its data and the ability to run ad hoc reports and pull data at any time. So the beauty is that when a resident takes a ride in Lyft Pass, the Lyft Pass covers it. All of that data in real time shows up in your portal. So you're able to see Betty Yan took a ride from ABC Hospital to 123 Maple Avenue. That trip was 12 miles. The cost was $23. The trip was on Monday at 7:20 a.m. And the drop off was at 7:40 a.m. So all of that data, the organization is able to access. So from a data and reporting standpoint, yes, all of that is available to you to pull and be able to analyze.
Great. Jason, we have a question here. How can we get our residents to become willing participants in their own well-being and have them come up with ideas?
Yeah, I think that's a great question. I think it starts with meeting the residents where they are, and I think understanding, even on an individual level, what well-being means to them and what they're looking to get out of well-being. It's not necessarily buying them pizza as a thank you. I think that's on the whole overdone. It's always appreciated when residents can get food, but I think there's been an over-reliance in that, and that's shown up in some of the satirical videos in this community that pop up on the internet or otherwise. But I think just even an understanding of some residents about what challenges they're going through. Is it because they're far away from family? Is it because they're not home enough with their children? Is it because they've had to forgo weddings and other family and friend events, instead having to be on call? It could be something as easy as getting out an hour or two, or having the attending take sign out, or any other number of things to allow them to get to the dry cleaners, or pick up their child early from school, or just be outside and not in the hospital. And it can be something a lot more structured than that as well. It could be a softball game. It could be a trip. Our program sent us on a wellness retreat that was always very much appreciated as well. And the attendings covered the ORs during that time. But that requires a lot of buy-in from the program and the chair and the institution as well. But all of these things, it can be something very little. It can be the smallest gesture of kindness that can do that as well. Depending on how your didactics are set up within your program, is there a session where you can just, instead of teaching about certain physiology or certain conditions and differential diagnosis, instead talk about well-being and understand what you can do there overall as well? And I think this framework then even changes as more institutions shift to the residency programs kind of being the minor league farm systems to the eventual attendings being the major leaguers in the health system, looking at them as colleagues. And yes, they're still trainees and they're still learning, but it's a very different perspective if they're going to be eventual colleagues. And there are some programs that do that very well, and there are others that are still learning how to do that. But I think putting all of this collectively in perspective, and for my last answer to the last question as well, intentionally trying to define this. If you meet the residents where they are and you don't like kind of mandate well-being, but instead encourage them, as you would in any workforce, not necessarily mandating something, but how do you empower someone to help them help themselves? And I think that's where a lot of this comes from. So I think it's a great question, and strides we need to continue to make as a community as well.
Awesome. Thank you. What's our next question here? Sarah, do you mind?
Yeah, of course. So we had a question. I submitted my information through the website for the Lyft passes. Would you be able to provide a demo to our institution?
Absolutely. We'd love to.
Awesome. Thank you.
We have another question about having a strong wellness program in place, but if the residents are not comfortable taking part in it for fear of looking weak or whatever the reason, how do you change the culture of faculty that constantly says, when I was a resident? And I think this is that cultural change. This is that very ingrained kind of identity and dynamics that have existed in academic medicine for quite a while. And we see this pop up in the recent press in terms of, the older attendings are taking more call than younger attendings, and it's made it into politics as well, et cetera. But I think that's the piece, is how do you get together as a program and say, we need to change, and we need to innovate, and we need to be on the front lines of what's going on with the resident. This whole culture and fear of looking weak is something that I hope begins to really change. And I think we've made some strides in it overall, but it still persists. And I think it also, we could do a webinar just on this topic in itself, but just philosophically, what makes a great clinician versus what makes a great doctor versus what makes a great healer versus what makes a great leader in medicine are not always mutually exclusive, but they also don't always overlap entirely as well. And what a successful doctor is, and what a great doctor is, and what a good doctor is overall too. And so, yeah, I think the question is really, really important. And it also means that your attending should be buying into that culture and developing, look, what are our values of our program? And this is something we've seen at Thalamus again, as our organization has grown, really taking steps to define our culture. If you go to our website, you'll see something on our About Us page called Thalamus, where we actually list our leadership principles, our values, and our operating principles. And our team talks about these on a week-by-week basis. It's how we recruit. It's how we ask questions about interviews. It's how we define who we want to have at Thalamus and who we want to have building with us to serve this GME community. And so I guess it starts there. Again, intentionally, has the program taken the opportunity to say, this is our identity as a program. We are a internal medicine program or an anesthesiology program, but this is what defines our program at our hospital. And there will be elements of the health system in that, but there can also be a real identity in the program as well. And then, yeah, talk with your faculty. Asking for help should not be a weakness in medicine, and it often is. And so we need to change that culture, but we need to do it through discussions. We need to do it through forums like this. We need to do it at academic conferences. We need to do it at specialty conferences. Like, there's more than just what's the optimal number of preference signals. It's how do we build the actual next workforce of physicians that isn't going to burn out or have behaviors that we don't want to have as healers, because that trickles down to our patients, it trickles down to our healthcare system, it trickles down throughout the cultures of our institution. So I feel like I'm now doing my own TED Talk up here on a soapbox, but I think at the same time, this is the important piece of this topic. It is all interconnected to everything we are doing as educators. And so this might be a good spot to end looking at the time, but Shar, I'll turn it back over to you.
That was great. Thank you, Jason. Thank you, Betty. Last questions in here are we going to be sharing this recording out? We will be in the next few days. You'll get the recording in your email and access to it. Any other questions you might have, please reach out to the Thalamus and Lyft Healthcare teams on these links below. This was a great session. Thank you to our speakers. Thank you to our audience, and we look forward to doing more of these. Thank you.
Thanks, everybody.